It's Dr. James from Vets of Geelong, and today I'm talking about specifically why or how senior patients, particularly dogs, present to us with heart problems. What you might find is owners come into the consult room and they've got a bit of a history where the pets are breathing a bit different compared to normal. They might have that appearance. He or she's not doing more than they normally did. They're coughing a bit more. They're more lethargic. All of these things can be obvious in retrospect. Other non-specific signs are he or she is not moving. They're just resting more than normal. And so it's not till the vets do their exam and check their heart rate, their gum colour, how fast their heart rate was, how do their lungs sound. All these are little pieces of the puzzle to suggest that your patient might have some form of heart disease. And there are different forms of heart disease which we see. Some patients present to us with dilated cardiomyopathy, and typically those patients present differently compared to the ones with mitral valve disease. And they're probably the two main diseases we see, particularly in senior dogs. Both have, I guess, their pluses and minuses when you're dealing with heart disease. Both require medication, but both the patients can have substantially normal lives for an extended duration once they have started their treatment or treatment's instigated. Having personally had a little Cavalier Charles Spaniel who had severe heart disease, she was medicated from 4 years of age until she passed away at 10. So she had a normal life on her heart medication and was notably better once she was on it. She did start off initially with some exercise intolerance and breathing a bit harder. So I understand if you're watching it or going, that just don't seem right and you can't pinpoint it, let the team know, and obviously we'll do a thorough check to make sure the heart's not involved. Obviously things, if we're suspicious of heart disease, we might do things like ultrasounds or x-rays or certain blood tests looking for certain changes in their parameters that way. And these are all parts of the puzzle to get that end diagnosis. And once we do, we typically tailor the medication to the heart problem they've got. So sometimes you might find, for example, they're on an ACE inhibitor or a blood pressure type medication. Other times they're on a medication which helps the heart contract more efficiently. Other times they're on a diuretic medication which helps alleviate fluid in and around the lung space. They all have their place and they all do significantly different things to affect the heart, but ultimately the goal is to get the patient more stable and for as stable as long as we can, because this has effects on other well-being for the patient, not only at home or if they're in for us for certain treatments or anaesthetics. We just factor that in mind as part of the treatment. So if your concern your patient at home is breathing more lethargic, panting more, coughing more, reach out to the team. We're more than happy to check and make sure we can extend the life of your little pet. All the best, guys, and reach out if you're concerned. Take care.